Good evening, everyone, and we once again welcome you to another very important episode of Diabetes Bytes. And as all of you are aware that currently we are running a program called Save the Feet and Keep Walking campaign under the aegis of RSSDI. And this campaign was launched by the RSSDI National Executive on 10th of this month, and we are now in the middle of this program. So मेरा आप सभी को बहुत बहुत स्वागत हम आपका करते हैं इस प्रोग्राम में आरएसएसडीआई डायबिटीज बाइट्स में। और हमारे साथ आज हैं डॉक्टर बंसी साबू, हु इज द इमीडिएट पास्ट प्रेसिडेंट ऑफ आरएसएसडीआई, एंड डॉक्टर विजय विश्वनाथन, हु इज द वाइस प्रेसिडेंट ऑफ आरएसएसडीआई एंड इज आल्सो द प्रोग्राम कोऑर्डिनेटर ऑफ द सेव द फीट कैंपेन एंड कीप वॉकिंग कैंपेन. So welcome, sir. So first of all, let me congratulate both of you for this wonderful program. So I would like to hear more from Dr. Vijay Vishwanathan, sir. So what is the idea behind the Save the Feet Keep Walking campaign, and how is the progress going on?
Yeah, thank you, Amit. I think, can you hear me?
Yes, sir.
Yeah, so I think this is a beautiful campaign. Last year, our immediate past president, Dr. Banshi Sabu, did a wonderful campaign called Defeat Diabetes. So this year, the 50th year, we wanted to do foot care, and we selected this topic of Save the Feet and Keep Walking campaign. So as you rightly said, it's an all-India campaign, and we have 21 state chapters. So every state chapter is involved. The basic reason why we started this campaign is to create awareness among the people, among the doctors and the people with diabetes, about the problem of foot care. Because we know amputations occur every 20 seconds according to the International Diabetes Federation. Somewhere in the world, every 20 seconds, some amputation is happening. So we want to prevent amputations. We want to keep people with a healthy feet. So that is why we started this campaign, and it's going well. And as the program goes on, we'll discuss more about the campaign so far. Thank you.
Thank you, sir. Bansi sir, I would like to ask, and first I would like to inform you about one good thing. More than 5,000 doctors are now officially registered for this campaign. So how do you see this registration number, and what is your take on this?
It's a great campaign which is initiated by RSSDI under leadership of our Senior Vice President, Dr. Vijay Vishwanathan. And we are celebrating our 50 year of, it's a golden jubilee celebration. And as the diabetic foot, which is a neglected complication, which requires a lot of awareness in our country. And I must congratulate the D-Foot, Diabetic Foot Task Force, including you. You are executive member and coordinating this complete campaign. And we have more than 5,000 doctors across the country who are registered. I'm so happy that many of them, even not the member of RSSDI, we always urge them to become the member of RSSDI, but these doctors across the country, even in the small part of the country where they were not examining foot regularly, now they have become part of this campaign. This will increase awareness at the level of healthcare professional. At the same time, it will also increase the awareness to the society. Like today, we are doing Diabetes Bytes on the social media, where thousands of the persons who are laymen who are following us, they will also understand the importance that RSSDI, one of the biggest society in our country of a diabetologist, running a campaign on a fit. It means it's very important, and they will go to the doctor next time and they will see the doctor either for themselves or for their relative. They will ask the doctor, please examine the foot also. It's very important. And that sort of awareness which we want to create in our country, if we really want to prevent diabetic foot complication or amputation in a person with diabetes. That is number one. 5,000 number is really big number, which we are really, when we were thinking and starting the program, we were thinking that we will have more than 2,000, 3,000 doctors, but now we have more than 5,000 doctors who are part of it. And on this 14th August, when we are going to celebrate our 50 year of RSSDI, because it was, conceptualized the concept of RSSDI from All India Institute of Medical Science. Our founder, Dr. M.M.S. Ahuja, who has worked in All India Institute of Medical Science, where this organization born, and we are going to celebrate our 50 year of RSSDI at the same place. And before that, on eve of 14th August, that is 13th August evening, we are going to celebrate this Save the Fit campaign. We are going to have International Diabetic Federation President Andrew Bolton. He himself is coming to India on 12, 13, 14. 3 days he will be with us. And he himself is a diabetic food specialist. He is International Diabetic Federation President. And we are going to celebrate this campaign also on 13th evening. We all are very excited across the country that this campaign happened on 50th year. And I am sure once this campaign will be completed, we will be also giving the data to everyone, and other countries, other associations in the world, they will also would like to follow that what we have done, how we can, create a awareness across the country that more than 5,000 doctors are working together day and night to increase the awareness in our country. I'm really once again congratulating Vijay and Amit both. Vijay is a chief coordinator for this program, along with Amit and other task force member for this.
As you have rightly said, sir, the registration of 5,000 doctors itself is a big achievement for the campaign, because each one of them is getting regular information about the foot examination. They have been receiving monofilaments, and they have been encouraged to do more and more foot examination. So, Dr. Vijay, sir, how do you see it from the patient's point of view? From a patient's perspective, what is the importance of foot care? So, how often their foot should be examined? And what all should be done for the foot care?
Yeah, thank you, Dr. Amit. See, today the emphasis is so much on blood pressure, cholesterol, and all that. So when patients are also tuned towards cholesterol, blood pressure, HbA1c, that they forget the feet. So what we have done in this campaign is, we are, as you very rightly said, we are telling the doctors to examine the feet. And it takes only 3 minutes to examine the feet. It takes exactly 3 minutes to examine the feet. So nothing more. So we have devised a protocol for examining the feet, and it takes exactly 3 minutes. And it will take about 1 minute to enter the data. As Dr. Banchi said, we are trying to collect the data from all over India. So we will have data from India, which is for the first time in the world. How many people with diabetes have no sensation in the feet, have normal sensation in the feet? So I think it is very important to examine the feet, and that's what we are teaching the doctors. So when the patient goes in to the clinic, he is made to remove his shoe and socks and examine the feet is examined. So I think the shoe and socks is not. Some doctors insist on removing the shoe outside their room, but they don't insist on removing the socks. So here the patient has to remove the shoe and the socks and lie down on a chair or on a cot, and the doctor examines the feet. It takes only 3 minutes. Thank you, Dr.
I think, sir, you are very much right when you say this, because when we examine the feet of our patients, the patient also realizes the importance that why the doctor is spending so much time on the feet. Why is he? What exactly is he looking for? Why is checking the pulses? Why is he interested in my nails? And why is he pointing any cones, calluses? And so that also motivates the patient to take care of their feet more. This is what I believe, sir. So, Dr. Bansi, sir, I would like to ask you that as we are in the middle of this campaign, and now we are inviting more and more ideas and suggestions from our colleagues also, that we want to make it an integral part of our practice. So, how one should make it a integral part of foot examination, integral part of our clinical practice?
You're muted.
Unmute, sir.
Sorry. So in a person with diabetes, they require a comprehensive examination. It is everything, it is the examination of the system that will also include the part of foot examination should be the part of it, along with like educating the patients for monitoring, for taking the regular medication, compliance, talking about the diet, exercise, walking. Then you have to also find out that, a person who is whether a normal foot, he is at high risk of developing diabetic foot complication in future. So we have to also stratify, and accordingly we have to give them something called preventive footwear, something called therapeutic footwear, and then they may require some special reference also. Like suppose you are suspecting vascular insufficiency, severe neuropathic foot, they have already history of ulcer, they have already active ulcer. So depending on whatever the doctor he is having a specialist. Suppose I am running a diabetes clinic and who is having even a diabetic foot nurse, so I can do many more things. But someone who is a general practitioner or a primary care physician who is not even a diabetologist may not do many things, so he knows when he should refer also. Like Dr. Vijay Vishwanathan is running a big hospital of diabetes, and along with his himself having a big interest in diabetic foot, so even a complicated diabetic foot patients can be managed in his hospital, in his clinic, because they have full-fledged diabetic foot surgery department where somebody is there as a diabetic foot surgeon. So depending on your expertise in your center, you can decide, but each and every patient should be examined. And I'm not talking about only foot, everything is to be examined, because foot is very, very important. Why we are talking about this particular program? That foot is neglected complication. Whatever the amputation which are happening in India because of diabetes, I mean, believe me, they must have some small problem before some time, maybe years before, maybe 2 years, 5 years, 10 years, and some doctor have neglected that problem. If they had gone and shot their doctor, so that is very, very important. Even sometimes we are saying that before 3 years only this patient came, at that time patient was not having any complaint, but we have not educated that patient also before 3 years. If you would have told and educated the patient that please keep your feet, regularly examine, see your feet are at higher risk, you are already developing sharp-foot foot, you have this and this complication, this preventive footwear is required. So even after in between 3 years, he had not come, and today he had come with a ulcer or he had come with this, somewhere down the line we are responsible because we could not educate the patient at that point of time. Patient had given us opportunity before 3 years, he had come to our clinic. At that time, we had not educated the patient. So we should try to educate the patient more. It is all, diabetes is a disease of education. More you educate, more your patient will be compliant for everything, and more you can prevent the complication. Better diabetes control, better monitoring, better screening of the complication, and better prevention of the all complication.
Sir, I would also like to know from Dr. Vijay, sir, suppose if we identify a person with high risk foot, so just identifying the high risk foot, does it carry any other message regarding any other organs, any other organ involvement? And if it
Yeah.
does carry a message, then what are these messages, sir?
So thank you, Dr. Amit. Very good question. So I think the most important thing is it will help the person with diabetes to give up many bad things like smoking, alcohol, can damage the nerves, can damage the blood vessels. So the person is smoking, the doctor can say you do not have sensation in the feet, please stop smoking. And he will stop smoking because he doesn't want to lose his leg. So this will be a good way of telling the patients to give up on bad habits like smoking, alcohol, everyday alcohol, not once in a way alcohol, daily alcohol, and so on. Now, pertaining your question, if you have neuropathy, if you have peripheral arterial disease, which is the first one is the loss of sensation, and the second is loss of blood supply. Now, if you have neuropathy, loss of sensation, you could have many other complications. Especially, you can have a silent heart attack. Silent heart attacks are very common because of a condition called autonomic neuropathy. So, you can get silent heart attacks if you have loss of sensation in the feet. If you have peripheral artery disease, which is the blood flow is less in the feet,
Oh,
then you can have strokes. You can develop strokes due to less blood supply in the brain. You can have heart attacks because the same sort of
Sir, your voice has gone now. No, sir.
Can you hear now?
Yes, sir. I can hear you.
So I think if you have less blood supply in the legs, the same sort of blood vessels supply the brain through the neck and also the heart. So you can have heart disease, heart attacks, you can get stroke if you have less blood supply in the legs. So it is very important to detect. Many times we detect the brain stroke, predict brain stroke or predict heart attack from the leg. So the examination of the leg is very important because you can actually predict other organs getting involved also. Thank you, Amit, for that. That's a very good question.
I think, sir, so you have rightly answered that, sir. If the peripheral neuropathy is present or the peripheral artery disease is present, then it is a warning sign that there's something can be wrong at other places also. And if it is, if we can, so it is time to have a good glycemic control and a good foot care. Dr. Bansi sir, I would like to ask you for from a patient's point of view. अगर किसी को डायबिटिक न्यूरोपैथी हो गई है and we found that person is having loss of protective sensation, that is LOPS. So, what are the key takeaway messages for that patient? That what should be done for this patient, the patient self about the self care, so that this patient does not end up with more complications in the foot.
So सेंसरी न्यूरोपैथी हो जाने के बाद में जिसको हम ये कहते हैं कि सेंसेशन कम हो गए और लॉस ऑफ प्रोटेक्टिव सेंसेशन चले गए, खास करके उनको प्रोटेक्टिव फुटवेयर की बहुत ज्यादा जरूरत है। अभी दूसरा जो प्रॉब्लम है वो है हमारा ऑफ लोडिंग। एंड ऑफ लोडिंग डॉक्टर्स भी बहुत कम समझते हैं। टू बी वेरी फ्रैंक, इवन जो सर्जन ऑपरेट कर देते हैं या अल्सर को ठीक कर देते हैं वो भी बहुत कम समझते हैं। एंड ऑफ लोडिंग का जो प्रोसीजर है या करना है वैसे बहुत डिफिकल्ट नहीं है, लेकिन ये समझाना और पेशेंट को ये करना। मेरे यहाँ क्लिनिक के बाहर एक कॉबलर बैठता है एंड यू नो आई जस्ट डू सम माइनर चेंजेस इन देयर फुटवेयर इटसेल्फ जस्ट टू मेक इट ऑफ लोडेड एंड इट इज रियली गिविंग सो मच गुड रिजल्ट। क्योंकि जो न्यूरोपैथिक अल्सर हो रहा है या जो न्यूरोपैथिक कैलोसिटी डेवलप हुई है उसको आपको निकाल देने से या वहां पर एक्स्ट्रा गोज रखने से तो वहां एक्चुअली फुट पर प्रेशर ज्यादा आ रहा है, आपको उसको ऑफ लोड करना है। सो जो प्रोटेक्टिव फुट सेंसेशन की आप उसके पहले की बात कर रहे हैं अमित जी, कि जहां पर आपको पेशेंट को हाई रिस्क है, ऑलरेडी प्रोटेक्टिव फुट के सेंसेशन चले गए हैं या पेशेंट को बैलेंसिंग प्रॉपर नहीं है, न्यूरोपैथी पेरिफेरल न्यूरोपैथी बहुत सीवियर है, तो सबसे पहले एक तो मैं प्रोटेक्टिव फुटवेयर के लिए खास जो लोग अपने यहाँ इंडिया में चप्पल बहुत पहनते हैं, सो जो स्लीपर जो है वो बहुत कॉमन है, साउथ इंडिया में भी है, नॉर्थ इंडिया में घर में पहनते हैं और उसके अंदर आपको देखा होगा ऐसे करके चलना पड़ता है, आपको बीच में फंसी होती है और चप्पल के साथ चलते हैं और यहाँ पर जो आपको एक्स्ट्रा जो फुट के ऊपर और प्रेशर आता है, सो आपको वो हटाने के बजाय सैंडल या जूता, और वो भी बाहर से वाइट टो बॉक्स वाला आपको जूता देने का है, आपको सॉक्स देने का है, आपको इंसोल देने का है। यदि कोई जगह कैलोसिटी है, कोई जगह एक्स्ट्रा प्रेशर है तो वहां ऑफ लोडिंग करना है। ये तीन चीजें बहुत ज्यादा जरूरी है यदि हमको उनके फुट को प्रोटेक्ट करना है या आगे अल्सर नहीं होने देना है। ये चीज अपन को सबसे ज्यादा जरूरी है। यदि हम ये इतना कर लें तो मेरे को लगता है काफी हद तक वो जो कंडीशन पर है उससे आगे नहीं बढ़ेगा। और कुछ ये जो अपने पास फुट के एटलस भी है, अपने अपने यहाँ से इंडिया से शरद पेंट ने किया था, उसके अलावा भी मैं पेशेंट को कई बार समझाता हूँ और कभी कभी दिखाते भी है कि देखो ये इतनी खतरनाक परिस्थिति में आ जाएंगे यदि हम इसको प्रोटेक्ट नहीं, क्योंकि उस समय पेशेंट को समझ में नहीं आता कि डॉक्टर साहब ऐसा नहीं करेंगे तो क्या हो जाएगा, क्यों इतनी माथाकूट कर रहे हो। तो हमको कभी कभी ये दिखाना भी पड़ता है कि देखो इससे कैसे पैर खड़ा हो जाता है, कैसे काटना पड़ता है, कैसे काला हो जाता है, कैसे खराब हो जाता है। तो ये सब परिस्थिति में बिगड़े नहीं, इसके लिए हमको अर्ली केस होना चाहिए। दूसरा, कभी कभी अर्ली चारकोट फुट होता है, जब आर्थ्रोपैथी होती है, रेड हो जाता है और उस कंडीशन में भी पेशेंट को रेस्ट कराने के बजाय पेशेंट फिर भी चलता रहता है, तो फिर वो कंप्लीट फुट कोलैप्स हो जाता है। वो कंप्लीट चारकोट जो अर्ली आर्थ्रोपैथी है उस समय उसको प्रोटेक्ट करना भी बहुत इंपॉर्टेंट है। तो ऐसी कई चीजें हैं जो हम कॉन्स्टेंटली हमारे डॉक्टर्स को एजुकेट करते रहते हैं। एक डेडिकेटेड डायबिटिक फुट की कॉन्फ्रेंस होती है इंडिया में हर साल, हमारी RSSDI की कॉन्फ्रेंस के अंदर हम डायबिटिक फुट के ऊपर वर्कशॉप और वो करते हैं। नेशनल लेवल के ऊपर भी ऑनलाइन हमने डायबिटीज फुट के बहुत सारे प्रोग्राम किए हैं। डॉक्टर विजय विश्वनाथन ने हमारे उसमें ऑनलाइन काफी लेक्चर्स है जो हमारे वेबसाइट के ऊपर है, और प्लस हम कंटिन्यूस ये एजुकेशन का प्रोग्राम कंटिन्यू कर ही रहे हैं फॉर हमारे प्राइमरी केयर फिजिशियंस एज वेल एज डायबिटोलॉजिस्ट।
Thank you, sir. Dr. Leela Baid from Chennai is asking one question, and he is asking that how many times we can use one monofilament. I think Dr. Vijay Vishwanathan says this is a very, very common question, and many people would like to know the answer.
So the monofilament is made from horse's hair, and the buckling force you need to make it buckle on the foot at 3 points, and the buckling force can change if you continuously use it. So you can use it maximum in about 20 patients in a day, and in about maximum 100 patients with one monofilament. After that, you have to change. Though the guidelines say that you should use it less, but I think for economic reasons, you can use it for maximum 100 patients, one monofilament, and use not more than 20 times in a day. And that's quite possible. We don't examine the feet of more than 20 people in one day. Thank you, Dr.
And one of the viewer wants to ask, what are the top habits which increases the risk of foot amputation or death in patients with diabetes?
See, if you come very late to the doctor with an infection, we had yesterday one patient whose infection has gone beyond the knees, so we had to do an above knee amputation. So if you go very late to the doctor, to the clinic, then we cannot save the feet. So the moment, because you don't have sensation, so if you have no sensation and if the infection spreads very fast like wildfire from the toes till the knee, then it's too late before you go to a doctor. You will think you can go tomorrow, day after. And when you get high fever, you will go to the doctor. But by the time it's a bit too late. So the thing is, if you have any doubt that your foot is injured, even if you have no symptoms, you should go to a doctor, to your family physician, and ask him whether am I okay. And you have to examine the injury every day with a torch or with whatever equipment you have at home. But death is possible only if you have a life-threatening infection, sepsis as we call it, infection, very severe infection coming from the leg, from the foot, where death is possible. So death is very common, or amputation below the knee, above the knee is very possible, very much possible if you go very late. So please do not go very late to a doctor, to a surgeon, to a physician, family physician. Go early. That's the main message.
And I think the prevention is always better than cure, because there are certain studies which says that if you have diabetic foot and you have developed an ulcer, even if the ulcer heals, then the chances of recurrence are very high. If still the glycemic control is very poor, and the cardiovascular mortality in next 5 years is again increases in these patients. So, and a few words about it, Dr. Bansi sir. Sir, unmute.
I'm sorry. I'm really sorry. There is some call.
Sir, I was just saying that once a patient develops diabetic foot ulcer, then the chances of recurrent ulcers are very high. Even at the end of the 1 year, the patient may again develop the ulcer. And again, the risk of cardiovascular mortality, even a death due to secondary causes, not directly from the infection, also increases many folds in these patients.
So, amid that, we have to understand that any complication in a diabetic patient, if one complication you get, it means there is all possibility that patient is having other complication too. So suppose you have a patient with a sensory neuropathy, you must think that patient have developed retinopathy, patient have a neuropathy, patient have a nephropathy or not. You screen for each and every complication of your. Suppose he had already developed a ulcer. Was it a neuropathic ulcer? Was it a vascular ulcer? If there is a vascular ulcer, the possibility of coronary artery disease are very, very high with the persons with peripheral artery disease. Now, suppose a patient who had an ulcer, and now you are saying that he is having high risk of developing ulcer. He is not only having high risk of developing recurrent ulcer, but he is also having high risk for other complication. It means the patient sugar is was not very good control. That's the reason he has developed one complication. He may have other micro and macrovascular complication too. So these patients require more frequent monitoring, more frequent screening of all other problems also. And as I told you, if someone had a ulcer, history of ulcer, it is the offloading only can protect if it was a neuropathic ulcer. Primary ulcer was neuropathic. If it was a vascular ulcer which has got healed, then now you have to think from a vasculature point. Patient is higher risk of developing stroke or even coronary artery disease and other peripheral artery disease problems. So you know how comprehensively a physician is taking care, and these are the high risk patients. Actually, they require a diabetologist approach where all these systems are to be examined very carefully. It's not just a primary care physician approach. Now we have to be very careful.
Sir, some of our viewers, they are asking what is offloading. So can you explain them in a simple common language that when we are saying offloading, what does it mean, sir?
हिंदी में बताऊं तो एक बहुत सिंपल बात है, जैसे हमने किसी को कोई चीज के ऊपर हमारा प्रेशर दे रहा है, ठीक है, कॉन्स्टेंटली आपका जो प्रेशर दे रहा है उसकी जगह हम वहां से प्रेशर हटा दिए। अभी कैसे करेंगे? सपोज करो कि हमारे ग्रेट टो के ऊपर आपके फुट के ऊपर कुछ अल्सर या कैलोसिटी डेवलप हो गई है। सो मैं क्या करूंगा कि उनका जो जूता है उसके जूते के नीचे के सोल के ऊपर आई विल जस्ट बाहर की ओर एक अलग से आधा इंच की चौड़ाई ऊंचाई का लगा दूंगा, तो पूरा जूता आपका यूं हो जाएगा। यानी ये जो पैर का अगले का भाग है वो आप उसका ऊपर रहेगा, वो धरातल पर टच नहीं हो रहा है, यानी वो ऑफ लोडेड हो गया, वो एयर में है, वहां पर कोई प्रेशर नहीं है, उसके ऊपर एक्स्ट्रा प्रेशर नहीं है। ये सिंपल लैंग्वेज में ऑफ लोडिंग है। हम इसके लिए इंपॉर्टेंट इंसोल भी आते हैं, काट के भी बनाते हैं अलग से ऑफ लोड करने के लिए। हाफ शूज भी होते हैं, रोकर बॉटम शूज भी होते हैं, कई वेराइटीज ऑफ शू है डिपेंडिंग ऑन द कंडीशन कहाँ पर है। शार्कोट फुट वाले पेशेंट्स के लिए आपको रोकर बॉटम शूज बनाने पड़ते हैं ताकि उनका वहां पर वजन एक्स्ट्रा नहीं पड़े, नहीं तो वो चीज को अल्सर हो जाएगा। सो ऑफ लोडिंग एक डॉक्टर या जो डायबिटीज फुट स्पेशलिस्ट है, या आई विल से जो डायबिटोलॉजिस्ट है, जिनके क्लिनिक में डायबिटिक फुट नर्स है या डायबिटिक फुट एजुकेटर है या पोडियाट्रिस्ट है, वहां पर ये काम बहुत इजीली और अच्छे रूप से हो सकता है और बहुत कॉस्ट इफेक्टिवली हो सकता है। अगेन इट रिक्वायर्स लॉट ऑफ एजुकेशन। पेशेंट को समझाना ज्यादा इंपॉर्टेंट है बजाय ये चीज को जूता बनाने किया या उसका कॉस्ट बहुत ज्यादा नहीं है। विजय कैन ऐड फ्यू मोर थिंग्स।
Yeah, other thing, Amit, if I can answer, because our secretary, Dr. Sanjay, is waiting. So I think the most problematic thing is temple. When you go to a temple or a mosque, you are supposed to remove the footwear. Then what do? So we advise people not to go in the hot sun. So you should either go before 8 o'clock in the morning or after 7 p.m. in the night. Don't go when the surface is very hot because you don't feel it. So, or you can wear a socks and go. You can wear any cotton socks. No temple will help you, make you avoid cotton socks. So the temple walking is very, what you say, mandir in Hindi. So I think when you go to a temple, please take care, extra care, not to go early morning. I'm sorry, not to go after 8 a.m. and not to go before 7 p.m. Thank you, Amit.
That is a very important point, because sometimes the patient may come with a entirely burned sole and the feet. So that is a common complication. Now we have Dr. Sanjay Agarwal with us, and Dr. Sanjay Agarwal is one of the pillar of this campaign. He has done a lot of work for this campaign. He has guided us in developing the digital platform. And now, sir, congratulations to you. One good news is that now we have boarded almost 5,000 doctors in India for this campaign. So a big round of congratulations.
Congratulations to the entire team, not for doing such hard work to see that everybody has contributed to the success of this campaign.
So now we would like to learn some more things about you for this campaign, sir. We would like you to motivate our doctors as well as the patient. So if any patient is watching, we will request them to go to the doctor and ask them to examine their feet. And if a doctor is watching this program, then we will request them to examine the feet of the patient. So, few words from you, sir.
Thank you very much, Amit. And I will answer this question partly in English and partly in Hindi for the benefit of everybody. The whole idea of starting this campaign countrywide was to bring the focus of feet care in patients with diabetes all across. Often, that's the one thing that gets missed out. People don't see their feet. And when they don't see their feet, they come to us with many complications which are related to diabetes, with diabetes foot. So they may have loss of sensations, they may have non-healing ulcers, they may have deformities, they may have gangrene, they may lose their feet. And obviously, these things are potentially avoidable. All it needs is examining your foot. Just look at your foot. And, I always tell people that in our culture, feet is very important. It's a sign of respect. When we touch the feet, we say it's a sign of respect. For the doctor, it has different meaning altogether. When a doctor touches a foot, he can make out, one, how is the nerve supply? So is his nervous system okay? If the feet are cold, you know that there is no inadequate supply to the blood supply to the feet is inadequate. If he's unable to touch his feet bending forwards, he's got a lot of central obesity. So you can make out that this person cannot touch his feet, right? Deformed feet are something that, we are always concerned about because it hampers walking and they keep getting recurrent injuries. So touching the feet is very, very important. It's not just a sign of respect, but it is a reflection of your medical status, the medical health of you, and particularly how your diabetes is behaving. So please do not ignore your feet. और मैं यही कहना चाहूँगा सब सुनने वालों से कि हमेशा एक आईना लीजिए और अपने पैर को देखिए. जब आप नहाने जाते हो और पैर को धुलाई करते हो, तो आपको ये पता होना चाहिए कि आपके पैर में सेंसेशन है या नहीं, कहीं जख्म हुई है क्या, कहीं पे कोई इन्फेक्शन हो रहा है क्या. एंड अगेन इफ यू टच द फीट एंड यू फाइंड इट वार्म, कि कोई इन्फेक्शन वहां पे डेवलप हो रहा है. सो अगेन द फीट डज टेल यू कि आपका कैसा है, कुछ इन्फेक्शन वगैरह तो नहीं डेवलप हो रहा है. और खास करके अगर आप नहीं चल पाते हैं तो हो सकता है कि आपके नर्व सप्लाई की वजह से मसल्स भी वीक हो रहे हैं और वो आपको चलने नहीं दे रहा है. तो अक्सर हम ये बोलते हैं कि आपके घुटनों में तकलीफ हो सकती है या कमर में दर्द हो सकता है, पर अक्सर ये नर्व्स के वजह से आपके मसल्स वीक होकर के आप नहीं चल पा रहे होगे या गिर जाते हो और बार बार चोट लगती है या और कोई तकलीफ होती है. तो ये सब सोचते हुए हर पेशेंट जिसको डायबिटीज है, एक कर्तव्य डॉक्टर का होता है कि वो पैर छू करके उनका देखे ताकि उनकी शुगर कैसी है और शुगर से संबंधित कोई पैर में कोई कॉम्प्लिकेशन है क्या, जिसका वक्त पे उसका इलाज हो सके पता करके. पर हर पेशेंट का एक प्रॉबेबली एक जरूरी होता है, जरूरत होती है कि वो अपने पैर को रोज तपास के देखे कि वो किस तरीके से उनका पैर है, उसकी मालिश करे, उसको सॉफ्ट रखे पैर को, सोल्स को, और जैसे है हम ख्याल रखें कि कोई जख्म वगैरह नहीं हो रही, पैर हाथ लगा के देखे कि उसका सेंसेशन है कि नहीं. अगर आप पैर में जूते पहन के चल रहे हो और जूते निकल जाते हैं, चप्पल निकल जाती है और आपको पता नहीं लगता है, तो हो सकता है कि आपके नस जो है बराबर नहीं काम कर रहे हैं, या आप जब चलते हो और पैर में दर्द होने लगता है जिसकी वजह से आपको रुकना पड़ता है, तो वो हो सकता है कि आपकी कहीं ना कहीं खून की नली में रुकावट है और खून नहीं पहुंच पा रहा है जिसकी वजह से आपको रुकना पड़ता है. तो ये सब बातें जो है हमें पता लगती है कि आपके पैर को आप और हम दोनों पैर को छू करके देखें. तो मेरा एक ही कहना है पेशेंट्स को कि आप प्लीज अपने पैर को जरूर जांचिए, इररिस्पेक्टिव आप कितने अच्छे हेल्थ में हो. और हर डॉक्टर को आई वुड ऑलवेज सजेस्ट दैट इट्स पार्ट ऑफ योर क्लिनिकल एग्जामिनेशन. डू नॉट इग्नोर टेस्टिंग द फीट of every patient because it's a reflection of the overall health of the patient. Thank you.
Very well said, sir. And I must congratulate all of you that you purposefully kept the duration of this campaign for 30 days. I think 30 days is a good enough time for anybody to learn a new skill and to regularly practice that skill so that it becomes a part of our regular day-to-day practice. So if I examine a feet of every patient every day and I do it for 30 days, I think I am likely to carry that skill with me even after the campaign. So that is something which is very well scientifically designed. So on that, sir, I would like to have one final comment from Dr. Bansi, Dr. Vijay, as well as Dr. Sanjay, sir, before we close this program. So Dr. Vijay, sir, first, your comment first.
Yeah, Dr. Amit, I think you have taken a lead role in this campaign. So I think the first thanks to you and to Sanjay Agarwal and Banchi Sabu and everybody for having created so much of awareness in the country. So thank you, Dr. Amit, for driving this campaign. And I think we have shown in this campaign for 1 month that foot care is very important and prevention of amputation is very important. Just as prevention of kidney failure is important, blindness is important, heart attacks, heart failure is very important. We have shown in this campaign that it's very important to prevent amputation. So I think we thank RSDI for taking up this campaign, and I am very confident that more and more doctors will join this campaign. Thank you.
Dr. Sanjay, sir.
Thank you very much. I think, Amit, as we have always said, that, we stand as a body together, and our first endeavor is to see that we make lives of our patients with diabetes better, better, and better. And we always want to strive to see that how can we educate them and make them aware of the fact how best to control their diabetes and prevent complications. Because once you're on a path to complications, it's just a series of complications that develop. And we always say complications beget complications. So if you have one complication, the other complication is just around the corner. So the secret of good health is you should avoid getting the first complication, which means that you're doing well. And this is what we want to bring to awareness. And I want to thank the entire team, which, mentored by Vijay. He's been very modest to keep in the backside, but I think he's been the soul of this entire journey. And Amit, of course, who's been the horse who's been driving the entire
entire cart is he's driving.
Yes, and of course Bansi, who motivates us all the way to see that we don't fall back, and he's always pushing us to see that you have to deliver. So I think all three of them have been absolutely exemplary to see this meeting as a big.
But it is all because of a very, very able secretariat, and you are the real one who is, it's a torchbearer. Even you are not president but secretary for RSSDI. It is all
and the secretariat.
Secretariat had really made the RSSDI height very, very high. Yes, Dr. Vijay, sorry.
And
we particularly would like to thank Mr. Mayank for creating.
Yes, he has to be thanked for such wonderful creatives.
And sir, it would be undermining the efforts of Dr. Purvi Chawla if we don't thank her. Today she couldn't join this program.
Social Bytes, since last so many 2 years we are doing.
Purvi, you need to come on the show, because we need to have you on the show and say you're doing an incredible job and you're trying to see people through different languages are educated. It's not just single language. So Purvi, if you're there in the back end, please come up and we want to see you on the show.
So Dr. Purvi, sir, she messaged me today. She is not able to join because of some patient in the hospital. So, but we would like to thank her for her constant support, efforts for the Diabetes Bytes, and running the Diabetes Bytes every week and almost every day for this campaign is something which is really very, very much appreciable. So with this remark, I would like to conclude the program for today, and I will request all the members of RSSDI, all the physician doctors, whosoever is watching this program and is a part of RSSDI Save the Feet campaign, please make it a grand success and try to screen as many as patients as possible. With this, we would like to thank everyone. Thank you. Thank you very much. We will see you with another episode of Diabetes Bytes very soon. Thank you.
Thank you.
Thank you, sir.